Hi, my name is Sarah Robertson, and today I'm going to talk to you about prompts and the prompt hierarchy. So, in ABA and in other forms of behavioral therapy, the term prompting is used to refer to providing assistance or cues to encourage the use of a specific skill and teach the best way to reach a goal. Prompts are something we add to a situation to increase the likelihood that our client will respond correctly. Prompts can also alleviate some frustration in clients who may not know how to respond in the correct way and therefore decrease the likelihood that the client will engage in interfering behaviors. In ABA, the least to most prompting hierarchy is recommended and used. This means that therapists should initially choose the least invasive prompt and then move down the line of prompts until there is a prompt that allows the student to accomplish the directed task. Prompts are also antecedents, meaning that they are given before the behavior starts. Oftentimes, clients might not know how to perform a new skill or a difficult skill, which is normal, so prompting allows a client to perform and learn a directed task so that eventually they will be able to perform the skill independently. Also, there are some additional considerations when prompting clients. 1. Make sure that the student is attending before presenting any kind of instruction. 2. Individualized support. Remember that the type of prompts that will be used will depend on what skill is being taught, its difficulty level, and what the client's current skill set is. 3. Avoid unintentional prompts, such as putting materials in the same order every time, your tone of voice, eye gaze, or facial expressions. 4. Use differential reinforcement, meaning that therapists should provide greater levels of reinforcement for independent responses over prompted responses. 5. Make a plan to fade prompts, which I will discuss later in the video. 6. Monitor student success. Collect data on if a prompt was used and what kind of prompt was used. And 7. Lastly, consider the prompt you use, meaning that therapists need to ensure that the chosen prompt focuses on the client's attention to the instruction and does not distract from it. So now we're going to get into the different kinds of prompts in the prompt hierarchy. So here is a visual of the prompt hierarchy. It goes from the least invasive all the way down to the most invasive. So the 6 different types of prompts are visual, which also include positional, verbal, which include direct and indirect verbal prompts, gestural, modeling, partial physical, and full physical. So now I'm going to give you a description and example of each. So first there is the visual prompt. Visual prompting gives a clue to the client on how to respond using a picture, text, or video. Visual charts can often be used for teaching tasks such as hand washing, brushing teeth, and toileting. First then charts are also another form of visual prompts that show a client what they are doing first and what will be coming next. Visual prompts can also include positional prompts, such as putting the correct item closer to the client. If the client is supposed to go to the bathroom to wash their hands, the therapist might put the soap and a towel on the edge of the sink to give them a prompt. Then there is verbal prompts. Verbal prompting uses verbal language to help cause the correct response. This can either be direct or indirect verbal prompts. A direct verbal prompt could be when the therapist is teaching a client how to make a sandwich. The therapist could say, put the meat on one slice of bread, then put the cheese on the other slice of bread, and then put the 2 pieces of bread together. An indirect verbal prompt would be giving a hint or clue without providing the total response. So again, when a client is making a sandwich, the therapist could say, well, what comes next? Then there is gestural prompting. Gestural prompting means that the therapist makes a kind of gesture, such as pointing, to the correct response. So if the therapist told the client to touch the spoon in an array of 3, the therapist might point to the spoon to provide a gestural prompt. Then there is modeling. Modeling involves the therapist mimicking the correct response for the client to see. If you tell a client to touch the spoon, then the therapist would touch the spoon first to show the client how to respond in the correct way. Then there is partial physical prompting. This is where the client provides minimal physical guidance, just enough physical guidance to get the client to start engaging in the desired response. If the client is supposed to clap their hands, then the therapist might lightly touch the client's elbow to initiate the movement. Then last, there is full physical prompting. Full physical prompting is where the therapist physically moves the client's body to engage in the correct response from start to finish. Again, if the client was told to clap their hands, the therapist would grab the client's hands and clap them together for the client. It also needs to be noted that once a client is engaging in these prompted skills regularly and have grown accustomed to providing the correct response, then prompt fading strategies must be introduced. It is important that the client does not become dependent on prompts to be able to respond or engage in the correct behaviors long term. The end goal for clients is that they are able to engage in directed tasks independently. Thank you.